Hey there, it's Dr. Justin Marchegiani. Today's video is going to be on IBS, Irritable Bowel Syndrome. Again, we're going to look at some natural solutions to IBS. We're going to compare and contrast the underlying mechanisms. We're going to compare and contrast what the conventional doctors are doing, and then what we can do as functional medicine doctors to get to the root cause and actually promote healing. So let's dig in here. What are some IBS symptoms? Oh, first off, let's not confuse IBS with IBD. IBD is Irritable Bowel Syndrome. This kind of falls into the category of Crohn's or ulcerative colitis or microscopic colitis. These are like inflammatory bowel conditions. They're typically autoimmune in nature, like with Crohn's or ulcerative colitis. A lot of times there's bleeding and ulcerations, and there's just a strong autoimmune component where there's significant increase in inflammation. Where IBS, we may not have the inflammation component. On the lab work, I would say personally there is inflammation, but at the same time, there are underlying things that we have to work on and address. So let's dig in. Some of the key IBS symptoms we see are abdominal bloating, cramping, diarrhea, constipation, gas, mucus and stool, which is like the inner kind of gut lining almost shedding like a snake sheds its skin a lot of times. And these are non-inflammatory conditions, but I would say that a lot of the foods that people eat are still going to be promoting inflammation. They may not show as like maybe increased calprotectin or lactoferrin or C-reactive protein. These are inflammatory markers that conventional physicians may use. A lot of conventional physicians don't even use some, like I use the calprotectin and lactoferrin markers in some of the stool tests I do. That'll give me a nice sign of underlying inflammation. And again, when it comes to inflammation, we're not going down the route of Celebrex or non-steroidal anti-inflammatories or COX-2 inhibitors. We're going to actually fix the underlying issue. We'll use natural herbs too to help suppress inflammation without all the nasty side effects like ulceration, liver issues, and low glutathione. So again, we talked about some of the symptoms. Let's talk about some of the conventional medications. So we have like our anti-diarrhea meds. These are like Imodium or Pepto-Bismol, right? We're just treating the symptoms of the irritable bowel. Antispasmodics is a Levsin or Bentyl, etc., right? We have fiber supplements. We have Metamucil and Citracel. These are fiber products. We have the antidepressants like SSRIs, like Paxil and or Prozac or tricyclic antidepressants. And we have antibiotics like Xifaxan or Rifaximin. Same antibiotic, just different name. So typically with diarrhea meds, we're just treating the symptoms of diarrhea. We're trying to slow down the reason why the intestines are pushing things out so fast. Most of the time we see diarrhea, there's some kind of toxicity in the system and the bowels are trying to flush it out as fast as possible. That's the underlying issue. So why would we want to slow down the digestive tract if our body's intuitively trying to push things out of the intestinal tract? So we want to use things to help bind it up, make things less, I should say, take away the toxic burden of the gut, maybe adding in some soluble plant fibers. We may even want to add in diatomaceous earth. Things like ginger could be helpful sometimes. Ginger is really good when there's constipation and slow bowels, but it can also be helpful with anything inflammatory. Diatomaceous earth, charcoal, bentonite clay, soluble paleo plant fibers can be really good to help kind of put a straitjacket around some of the toxic compounds so the body can escort it out slowly versus having to flood it with a whole bunch of water and create diarrhea and also malabsorption. So the antispasmodics, right? These are going to be just your spasms in the gut. You're feeling like the cramps, right? And why is that happening? Well, typically that's happening because the vagus nerve and the acetylcholine receptors that help stimulate the vagus nerve are being overstimulated. And a lot of times that's going to create these spasms. So a lot of times these drugs will actually help decrease that stimulation so you don't have the spasms occurring as much. So a lot of these drugs are like acetylcholine inhibiting medications. The fiber, again, same thing. That can be helpful for the diarrhea. Conventional medicine just uses the typical Metamucil, which is psyllium husk, which could be helpful, but a lot of times they're using conventional psyllium, which is going to be high in pesticides, high in chemicals, and it may be irritating in some patients. I've seen it cause problems in some it's helpful, some it's not. I typically stay away from that fiber just by itself. Some people, we don't even do fibers, we do more soothing things to help reduce inflammation. Sometimes we even use probiotics and anti-inflammatory herbs like turmeric can actually help slow down the intestinal tract. So we'll actually use turmeric sometimes, when sometimes we have gastroparesis and things are going too slow, we'll use ginger to speed it up, and we can use turmeric to actually help slow it down, along with boswellia too. Antidepressants, we talked about that. Antidepressants can help with peristalsis because we know 99% of serotonin is located in the gut and made in the gut. Now that serotonin doesn't cross the blood-brain barrier. We have to have 5-HTP and L-tryptophan cross the blood-brain barrier, actually 5-HTP cross the blood-brain barrier and convert the tryptophan, or I should say convert the serotonin in the brain. So a lot of times when we talk about serotonin in the gut, a lot of that won't cross the blood-brain barrier. So we have to have good digestive absorption. And a lot of times when there's bowel movements that's faster or stronger, or we have a lot of gurgling and things moving around, it's almost a sure sign that there's probably going to be some degree of malabsorption present. We're not absorbing or breaking down proteins, fats, vitamins, minerals, etc. So having HCl, enzymes, even getting some spore-like probiotics to help reduce inflammation can be a really great start in the right direction. Antibiotics, Xifaxan and rifaximin are the two big ones that are out. They're the same things, just same thing, different name. These are typically used for SIBO, small intestinal bacterial overgrowth, when we see an elevation of methionine, an elevation of methane and hydrogen on a breath test. And we'll typically see that methane above 3 and upward, hydrogen, a difference between 15 to 20 per sample is a positive indicator. I've done a whole video on SIBO breath testing, so see that video later. And again, these are typically used. We will use a lot of times antimicrobial medicines like oil of oregano, berberines, artemisia, alicillin, silver. We'll even use some other things like clove and wild indigo and java persei, etc. And we will add these herbs and we'll knock out whatever infections there. And different herbs are better for other infections, so to speak. So we went over the conventional medical treatment. Now, functional medicine approach, right? We're using the 5 R's. So we've kind of already, I interwove some of these functional medicine treatments above here, but the 5 R's, it makes too much sense. We're removing the bad foods. We may go autoimmune paleo, right? No nuts, no seeds, no nightshades, no grains, no legumes, no dairy. We may also add in the autoimmune element where we're having no nightshades, no nuts, no seeds, no nightshades, tomatoes, potatoes, eggplants, peppers, and no eggs. And we may even add in the the low FODMAP element along to the autoimmune, where we're having low fermentable carbohydrates, where we're cutting out maybe broccoli or Brussels sprouts or onions or garlic or sweet potatoes or even avocado, right? So we have a nice little handout where we start off with maybe the autoimmune paleo to start. We may kick into gear and go more lower FODMAP as well. And we may even cut out things like histamines too and add a rotation element. So we have a couple of things we can do with the first section of removing the bad foods. Number 2, replacing enzymes, replacing acids, replacing bile salts, secretions to help our body break down the constituents of our macronutrients. Breaking down protein, breaking down fat, breaking down carbs, assimilating nutrients, breaking down minerals, ionizing minerals so we can absorb all of our nutrients, our vitamins, our minerals, and our macronutrients. Very important. Third R is repair. And when we repair, a lot of times we're adding in gut nutrients to help healing, L-glutamine, glycine, N-acetylglucosamine. We also could add in licorice root, slippery elm, aloe, Jerusalem artichoke, right? A lot of different things. And we could also add in some probiotic. Now, probiotic typically comes in at the last R, re-inoculate, but sometimes we'll add it in sooner if people have a lot of these conventional IBS symptoms. And I'll add in a probiotic that's a spore-based probiotic called Megaspore. It's also another one that I formulated called ProBioFlora is a really good one as well. And we'll add these in to help reduce inflammation because probiotics can help reduce inflammation. So if we have an inflamed gut, it may be something good to add in conjunction with the healing gut nutrient compounds that I already mentioned. So that's the first 5 R's, removing the bad foods, replacing enzymes, repairing the gut. The 4th R is removing. We're removing whatever infections we find, whether it's H. pylori, parasites, small intestinal bacterial overgrowth. It could even be viral infection like EBV. We're going to remove those things. And the fifth R is we're gonna re-inoculate with specific probiotics at very high doses, so it's therapeutic. We can have an effect on re-inoculation, but again, these guys tend to not stay there longer than a month or so. So we're putting it in, but they're kind of transitory. They're gonna make their way out in the next month. So we'll keep maybe some good fermented foods in. We'll add some probiotics in the first couple of months to really have a good effect. And then quarterly, we'll add some in just to really make sure we're having a lot of good beneficial flora get exposed to the gut. It'll help keep the tight junctions nice and tight like they should. And it will also help keep inflammation down, keep beneficial bacteria up, which means increase synthesis of B vitamins and vitamin K2 as well. So in summary, if you have a lot of IBS symptoms, start with the 5R protocol. Start with removing a lot of the bad foods first. After that, it kind of gets a little dicey if you don't have clinical experience on what the next steps to do may be. So subscribe to the videos, subscribe below to any of my video series, and click on the consult button if you want to dig in deeper and get to the underlying cause of your IBS, and not just play the symptom treatment game up here under the conventional side. May be helpful in the short run, but it's not solving anything in the long run. So click on screen, subscribe, and I hope you're enjoying this video, and there'll be a lot more to come. Thanks. Have a great night.